Hey, so one of our exemplars is pneumonia, and looking at medications, the pharmacology, and what we need to do is with pneumonia, we're going to treat them for several things. One, we usually have a fever. It's an infection in the lungs, and we're going to have a fever with that. So we're going to treat them with an antipyretic, right? Acetaminophen or a ibuprofen to bring that fever down. And then we're going to want to treat them with an antibiotic because that is how we get rid of or cure the pneumonia. That's the only way that we can do this. So these are some antibiotics and things that I want you to know about these antibiotics that are so important as a nurse. So let's get started. I can never see my little dotty dots. There we go. Vancomycin is the first drug, antibiotic I want you to look at. I have put in parentheses, it's a big boy. And the reason why I said that is I want you to think of it this way. There's two in this list that I consider big boys. They are for severe cases. When we are giving antibiotics to pneumonia, we are treating bacterial pneumonia. So this treats bacterial resistant pneumonia, and we're going to give them vancomycin. You always want to give this antibiotic slowly because it can cause red man syndrome, and we're going to take a look at that. Also, another thing that I would like for you to know with vancomycin is it can cause ototoxicity. So if your client or patient start to have a change in their hearing, a roaring, a buzzing, something different, and they share that with you, and they've got vancomycin infusing, your thoughts, or they're receiving vancomycin, your thoughts should be to stop it immediately and contact the physician. Okay, red man syndrome. This is big, and I want you to understand this. If I'm giving vancomycin and I give it too quickly, it will activate the histamine release, mast cells. And so what happens is they get this flushing or an erythema of the upper body, neck, face, arms. So we normally see it in the upper body. You can have it everywhere, but it's normally from the upper body, sometimes just the neck, face area, just depending. It's a flushing. You see an erythema, pruritus. They can have difficulty breathing and they can become hypotensive with this. So you do need to stop the infusion when you see this. And once again, it's not a true allergic reaction to vancomycin. It's just the medicine was given too quickly. So you stop the infusion, you can go ahead and administer an antihistamine, diphenhydramine. And then once that's given and all of the symptoms subside, if they resolve, then you can start the vancomycin again, but at a very, very slow rate. And the next thing you want to do too is if you happen to restart at a very slow rate is to watch that client or patient as it's infusion because you don't want this to happen again. So red man syndrome. So if I'm giving vancomycin, one of the main things that I want to do is give it slowly. One thing about this slide that I want to show you, which is really a great thing to understand, is usually if you stop everything, it will resolve. The red man syndrome will resolve. We want to run vancomycin IV, intravenous infusion, at least for 60 minutes, if not longer. Normally, we give it within an hour to an hour and a half. If we need to give it for a longer period of time, over 2 to 3 hours, then in that case, you probably need to pre-treat with an antihistamine because we're giving for such a long time that it can trigger that again, at that response for red man syndrome. So once again, if I give the vancomycin IV too quickly, I can cause red man syndrome, which is that flushing erythema. It's normally from the upper body, neck, face, upper extremities. If we stop it, it can resolve on its own. If we have it, we should stop the infusion. Normally, the doctors will order Benadryl so that we can stop that histamine response. And then if we're going to have to give it over a 2 to 3 hour period, we need to pre-treat with antihistamines. So this is something to really actually No, you will see it on boards. You will see it in the real world of clinical, and you will see it probably most likely on one of my tests. Okay, macrolids are another antibiotic choice for pneumonia. That is Zithromax or a Z-Pak that we see. These are narrow spectrum antibiotics. They normally treat gram-positive bacteria. So it is just going to be given. So we have gotten our sputum culture, and they have, coughed it up. We've gotten it in our cup. We've sent it to the lab. We've looked and grown, and they've grown gram-positive. It's a gram-positive culture. And then they're going to say, let's go ahead and give them a Z-Pak or a Zithromax, okay? When we do this, we want to also give Zithromax or Z-Pak or the macrolids for people that are allergic to penicillins. If anybody is allergic to penicillins, then most likely we'll flip it and give them the macrolids, the Zithromax or the Z-Pak. So I want you to know that about macrolids. It's a narrow spectrum. It's going to treat the gram-positive, and we give it to those who are normally allergic to penicillin. Good to know. I did want to bring this slide. I love this. Erythromycin, it gives you a couple of them, but what you need to know is erythromycin, and these are macrolids, and clarithromycin only are inhibitors of the cytochrome P450 system in the liver. Now, do I want you as a nurse to understand that, what the cytochrome P450 system in the liver is? Not at this moment, I don't, but what I want you to understand is that when I give these macrolids, I possibly can be inhibiting the cytochrome in the system of the liver. And because of that, it can cause an increase in concentrations of these drugs below. So I want you to take a look at these drugs. We have Cephalosporins, we have phenytoin, we have warfarin, Coumadin, digoxin, I mean, just theophylline. I mean, they're there. So just so you know, with macrolids, the easiest way to understand this is that erythromycin and clarithromycin only, just those two, are inhibitors of the cytochrome P450 system in the liver. And because of that, it could increase these drugs. So if I have a client or a patient that's on digoxin, and I'm going to give erythromycin to this patient, I could cause dig toxicity. So it's so important that we understand that. So I want you to write in your notes, or I want you to make your drug card, and I want you to put erythromycin and clarithromycin can inhibit the cytochrome system in the liver. And because of that, I could have an increase, put an arrow in dig and Coumadin, which is warfarin. So we need to monitor these patients, or really think carefully if we're going to give these medications. The doctor makes that decision. It's an order, but as the nurse, you need to understand that if I'm on these drugs, you need to be looking for the toxicities to making sure you're protecting your client or patient. Okay. Levaquin, fluoroquinolones, this is another ding, 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 big boy. It treats severe cases. Levaquin is a broad spectrum antibiotic. It's going to treat either gram-positive or gram-negative bacteria, but it can cause some really ugly side effects, Levaquin. So we need to be very, very careful when we're giving it. One, it can cause a C. diff infection. So in our intestinal tract, we kill all the normal flora out, and then we can have this actually cause this infection, which can cause horrible diarrhea. It's a stringy, runny, watery diarrhea that has a very different smell to it. It's a very foul smell, but it's a very different smell. Whenever you smell it and see it for the first time, you'll never forget it. So this can be detrimental to your patient and client for many reasons. It causes skin breakdown, also to just the deficit of losing all of that stool. And there's an infection in there, causing so many other things happening to the body. The other thing with Levaquin that I want you to understand is tendon rupture. So all of a sudden, you've got a young, healthy client that's had to take Levaquin for some reason. They put them on this, and all of a sudden they have a tendon rupture, and you're like, what's going on? For some reason, this is something that happens with Levaquin only. So tendon rupture is also something that can happen. And the other big thing is an EKG. It interferes with the electrical activity of our heart. It can. So QT interval can be prolonged. So you need to understand that. So if you have a client that's very ill and they're getting Levaquin and you get an EKG on them and you start to see a QT interval that's prolonged, you need to key in on that this could be part of the reason is this medication that we're giving. Okay, I wanted to show you this. I found this when I was online looking around for some things, and I found it quite interesting. This is way back in 2001, so it's been a while back. But the reaction rates were documented among this doctor's patients. A lot of them had pain, anxiety, and panic, loss of memory, and psychosis, taking Levaquin. 73% could have rupture of the tendon, tendonitis, weakness, and joint swelling. It's just a mean drug, but it's a life-saving drug if you have something that is a resistant infection that we need to treat. So it's like we treat whatever's happening because of it, but it was going to save your life, right? It's that kind of thing. I thought this was interesting. I'm not going to read it all to you. You can look at the slide yourself. They can become tachycardic, short of breath, have chest pain, palpitations. Some of them had rashes, hair loss, sweating, intolerance. These are people that took it. They can't, I love this quote at the bottom. It says it can make the cure worse than the disease. So it is not the antibiotic that we just pull off the shelf and say, here you go, please take it. But it is definitely an antibiotic that's a broad spectrum that's going to treat either positive or negative bacteria. And when we're dealing with pneumonia, sometimes we can have very resistant bacteria, and we need to treat with this because it's a life or death situation. Okay, indications. I gave you some indications for this. Severe pneumonia is our exemplar. It's right up there. Bronchitis, typhoid, UTIs. But when we're looking at UTIs, these are resistant bacterial issues. This isn't just something, you know, oh, you have a UTI, I want to treat it. We're going to treat this with some others that are out there, but we just want to be very careful. These are all infections, and we do treat with the antibiotic if needed. Cephalosporins are our next one. And I put a little // there. So on your notes, write Keflex, but go ahead and find its actual name. We also give Rocephin, cephalosporins, and I did give you that name. It's ceftotriaxone sodium. I butcher it, sorry. Anyway, because for your boards, you will have to know those names. You can't just say Keflex and Rocephin. You're not going to recognize it if you don't know it. For my students, I will correct that and get that up before I post on our Brightspace. There are different generations to the cephalosporins. There's a first and second generation that are narrow spectrums. We use the third and fourth generations. They're broad spectrum antibiotics. We want to watch the client if they have a penicillin allergy because they are connected. Now, you could have a penicillin allergy and not have an issue with a cephalosporin and vice versa, but it is definitely in the family. So we want to be very, very careful. If they have a penicillin allergy, highlight it, put it in bold, do whatever you need to do. You need to be careful giving cephalosporins because they could have a possible allergic reaction to the cephalosporin. Make sure you let the physician or make the physician aware of their allergies. It also can cause thrush, so always assess the client's mouth and tongue. That is a yeast, a fungal yeast that can happen in the mouth. We see it with babies that drink with their bottles. Sometimes you'll see thrush, and we do have to treat it. We use actually a swish and swallow. And sometimes we'll do a swish and spit depending, but the worry is that it'll go down the throat, that fungal infection. And because of that, it can cause a lot of issues for the client or the patient. It also hurts. It hurts to eat. It burns. Doing oral care can hurt. So they have we treat it. They can swish, they'll swallow, and it will cure what's going on. Just so you know, though, that can happen with cephalosporins. One of the things I want you to know about Rocephin, if I am giving Rocephin as an injection, given a Rocephin shot, we need to mix this with lidocaine. And there will be an actual protocol you can see, because it hurts. It's very, very painful. It burns. So we always give we put a little lidocaine and mix the Rocephin so that we hopefully can numb it just a little bit so the client or the patient isn't in severe pain from that injection. Okay. Tetracyclines are the next one. And the one that we give is doxycycline for pneumonia. Remember, I'm talking about antibiotics, but right now I'm talking about pneumonia. So you will see as we go on in pharmacology class, we will see other disease processes and infections where we're going to use medications to treat. But right now I'm looking at pneumonia as our exemplar. So doxycycline is a tetracycline that is a antibiotic of choice. It's a broad spectrum. It treats both gram-positive and gram-negative bacteria. But one of the things that I really want you to know is not to be given to a pregnant woman. It affects the fetus, guys. If they are pregnant and they take tetracyclines, it can stunt fetal growth in utero and can be very detrimental and harmful to the fetus. So we don't ever give it to a pregnant woman. So nursing, I come in, I have a client, the doctor wants to give tetracyclines to. What is the one thing that I want to do if it's a woman that is of age to have children? Don't ever underestimate. This day and age, we have women having children in their early 40s. So ask everyone. That's what I do. Is it a possibility that you could be pregnant? Are you pregnant? I need to know, because when we give this medicine, it can cause harm to the fetus. Normally, most women will go, no, I'm not pregnant. Love my acting. No, I don't want to have a baby. But sometimes if they're not sure, then what would you want to do? You would want to send down a pregnancy test. We would just go ahead and get urine, send it down to the lab, and to see if they are pregnant or not. So be very careful with that. They're also, tetracyclines or doxycycline can cause photosensitivity. So stay out of the sun. You go out in the sun, you can get really sunburned. Or make sure that you protect yourself if you're outside. Put the hats on, put the sunscreen on. But it can still cause exposure and cause you to have issues and become very photosensitive. Never take milk or antacids when you're taking these drugs. It'll affect absorption. So you want to stay away from it when you're taking tetracyclines or doxycycline. No milk or antacid affects absorption. And the other thing with tetracyclines, doxycycline, is it can discolor teeth. So don't ever give it to a child 8 or younger. We can discolor their teeth for life. So we can be we have to be very, very careful. Okay. I did post some common side effects. There are quite a few. I try to bold the ones that I really want you to understand and know. Most antibiotics, when taken, can cause nausea and vomiting. They just are very upsetting to the stomach. If you have any trouble swallowing, closing of the throat, hives, you need to not take the antibiotic. If you're taking this at home, you need to stop the antibiotic and call 911, because at this point you are having an allergic reaction and you need intervention. This could be life-threatening. So I didn't bold that, but I want you to understand that's for all antibiotics. Brown or gray tooth discoloration, if you start to have that, we need to report this to the physician immediately. If we have a blue, gray, brown discoloration of the skin, lips, tongue, or gums, it can discolor this part. That is a problem. We need to immediately let the physician know. Of course, we can have unusual tiredness, but we can have issues with our renals, our kidneys. So we want to be very, very careful. So if you start having a change in your kidneys, your urination, any kind of pain, problems, issues, the physician needs to know. Also hearing changes, because apparently tetracycline and doxycycline can cause ototoxicity too. We can have issues with that. And then there's a couple others, but at the very bottom, I want you to read this. It can decrease birth control effectiveness. So we don't want to give it to pregnant women, right? Because it'll cause it'll stunt the fetal growth in utero. But we want to be very careful to explain to our clients and patients that are on birth control, it will decrease the effectiveness. So there are a lot of women out there that take antibiotics that are on birth control, and all of a sudden they're pregnant, right? Because it decreases the birth control effectiveness. So we want to make sure that we explain that to our client and our patient, and let them know so that they can choose another form of birth control for extra protection while they're on the antibiotic. The last one that I'm going to go over is penicillin, and penicillin G is the one that we usually see for pneumonia. It is an antibiotic used to treat a number of bacterial infections. We're going to give it for pneumonia, but we give it for strep throat, syphilis, necrotizing enterocolitis, diphtheria, gangrene, and it just goes on. You can see it is a narrow spectrum antibiotic. And if you have an allergy to cephalosporins, like I said, you are going to most likely have an allergy to penicillin. So some people have only taken cephalosporins and they had an allergic reaction. So that should trigger you to know they're probably allergic to penicillin. So please let the physician know. This one also will decrease the effectiveness of birth control. So once again, make sure you are informing your client or patient if they're on birth control, that can decrease the effectiveness. It's a possibility of getting pregnant while on the antibiotic, even if you're taking the pill as prescribed. Is there any questions or concerns? I hope not. These are antibiotics that we use to treat pneumonia. I've tried to highlight the things that I really want you to know and understand about each. My suggestion to you is to get out your notes, to write the antibiotic out, and the things that really you need to understand, put those there, understanding if they're narrow spectrum, broad spectrum, and then from there, side effects or things we need to really understand as a nurse, especially with vancomycin and red man syndrome. I hope this helps. Also, one more note I want to say to you is always understand if a client or patient starts to have tingling, numbness of the mouth, the throat, if it starts to feel like it's enclosing, if they start to have hives, rashes, all of these are signs and symptoms of a true allergic reaction and can be life-threatening to our clients or our patients. So it's so important that they understand if they have this, they need to call 911. If they're at home, if they're in the hospital or in a clinic, they need to let the health provider or the nurse know what's going on so that we can actually give them some medication to stop that allergic response. You're going to do great. This is pneumonia, antibiotics. You got it.